on fatty liver, a public health challenge. Nash 24/7 aspires to bring best in class education and awareness program to serve healthcare workers, patients, and their caregivers. Today we have a renowned gastroenterologist from Jaipur, Dr. Jagveer Choudhary. He needs no introduction, however, I would fail my duty if I don't mention that. Dr. Chaudhary is a leading gastro in Jaipur, providing comprehensive and compassionate care to many patients for various gastrointestinal and liver conditions. He has experience building a clinical skill set that allows him to deliver patient centric care. He is a MBBS, MD, and DM gastroenterology and currently practicing at Hitarth Hospital. Sir, we salute your dedication towards spreading awareness related to liver health. So now I invite Dr. Chaudhary to enlighten us on the topic. Over to you, sir.
Okay, thank you. Thank you giving me this opportunity on the occasion of World Liver Day. Uh, and thanks for the kind introduction. So we are discussing the topic for the fatty liver or liver. Generally, in general, liver structures, anatomy, and the function and the disease affecting of the liver. So can we go to the next slide? Next slide. Okay. So first of all, we will discuss the liver anatomy. This is the body's largest internal organ, and they're made up of the cells. This is called as the hepatocytes, and it is located in the right upper quadrant of the abdomen. And the weight is around 1.5 kg, and it is and just a minute. Okay, and the weight in women is around 1400 grams, and in men is 1600 grams, just slightly higher than the woman. And it's divided in the right lobe and left lobe by the ligamentum teres. And this also similarly also divided into the back side between the right and left lobe. Can we go to the next slide? Okay, liver has dual blood supply, and this 70% supply come from the portal vein. This is the blood which is coming from the GI tract, which contains all the nutrients, and the 20% the supply coming from the hepatic artery. This is the blood which is coming from the direct from the blood and contains the oxygenated blood. Okay, next slide. Liver has three major types of cells, which are divided into hepatocyte, hepatic stellate cells, which also called as vitamin A storing cells, and the Kupffer cells. So hepatocyte they make a majority of the cells, around 90% of the total liver volume. They have numerous amount of mitochondria and the numerous macrovilli on their surfaces. And the second type of cells are the hepatic stellate cells. They majorly they store vitamin A, and they are found in the space of DC. And the third type of cells are Kupffer cells. They work like as a policeman of the liver, and they remove the uh, microorganism from the liver. Can we do the next slide? Okay, so now we talk about the liver functions. So basically, the liver functions we can divide it into the metabolic functions, protein synthesis, detoxifications, and production of and secretion of bile, and the other function like storage of lipid soluble vitamins and the vitamin B12. Next slide, please. Uh, Now we talk about the metabolic function of the liver. So first of all, glucose metabolism. So glucose is mainly absorbed by the small intestine and is transported by the portal blood flow to the liver and is stored in form of the glycogen. And liver can convert glycogen into glucose on the need basis. Similarly, as a lipid also divided into cholesterol and lipoproteins. So mainly cholesterol is synthesis in the liver, which regulate the integrity of cell membrane. Lipid also synthesis the lipoproteins, which transport the cholesterol into the various parts of the body. Protein synthesis mainly liver is synthesize amino acids. These amino acids are they are the building blocks of the proteins, And liver can also convert one amino acid form into the another one by the enzyme that's called as ALT, which is called alanine aminotransferases. Next slide, please. Uh, Protein synthesis. So all plasma protein except immunoglobulins, they are synthesized by the hepatocytes. If we talk about the albumin, this is the most abundant protein in the body, and this helps the maintain the oncotic pressure in the blood vessels. And if there is a decline in albumin synthesis, like any other chronic liver disease, that will lead to swelling of the bilateral feet or blood accumulation in the abdomen. Globulins, mainly the globulins, they are complement proteins. They are the various type of proteins. They play a role in the cellular immunity. And liver also synthesize the clotting or coagulation factors. They help the stop the bleeding, and they also help in the formation of the clot whenever the injury occurs to the blood vessels. Next slide, please. Liver also synthesizes bile. So bile is produced by the hepatocyte and secreted into the canaliculi. From there, it reaches to the bile duct, and from there to the second part of duodenum. So this bile contains various ions like cholesterol, lipids, bile acid and salts, and bile pigments. So bile also contains the bilirubin. Bilirubin is the metabolic product of the hemoglobin, which form in the mainly in the spleen, and from there it reaches to the liver by binding of albumin. And in liver, this unconjugated bilirubin is conjugated and secreted into the bile secretions. Whenever this normal flow or normal cycle is hampered, then that will lead to accumulation of bilirubin in the body, and the condition called as jaundice. Okay, next slide, please. Now will shortly discuss the function of bile here. So bile play a role in digestion, because in digestion this bile function as a biological detergent, and this uh, help the micelle formation. By forming a micelle, this will increase the uh, uh, surface area for the enzymatic action, so that can fatty food can be digested into the simpler form like fatty acids and the triglycerides. And excretion. So while also helping the excretion of cholesterol, bilirubin, and numerous drugs or toxic metabolites. Uh, so this bile enter into large intestine and are removed from the body by the stool. Next slide, please. Liver also do the detoxifications. So in day-to-day basis, our body generates so many waste products. So if they are not removed, they will cause harm to the body. So liver does the work of detoxify the body. So like alcohol, drug, hormones, and these are the toxin substances removed by the liver. And also liver break down the amino acid, and they convert the amino acid into the urea, and by removing these nitrogenous based product in form of urea through the kidney. And as we have already discussed, Kupffer cells, they are the policemen. They are the macrophage. They remove the microorganism invading the blood or the liver cells. Next slide. Now the other function of liver, like this is a storehouse of the body. So liver can store iron, lipid soluble vitamins A, D, and K, and the water soluble vitamin like B12. One interesting type of cell is the hepatic stellate cells. Generally, in normal conditions, store vitamin A. Under the some injury or some hepatitis or some other toxins, these cells, they are converted into the fibroblasts, and they produce collagen or extracellular matrix. In chronic liver injury, they continuously produce this excessive collagen, and then that will lead to the fibrosis, and ultimately, if not treated, then it's converted into the cirrhosis. Next slide. So now we discuss with the pathogenesis, symptoms, and the manifestation of some liver disease. So basically, in broadly, we can divide the liver into two types of disease. Like one affecting the hepatocytes, that is called hepatocellular disease, and one group of disease they affect the other type of cells. So these are called non-hepatocellular, like cholestatic disease, or disease some affect the vascular compartment, or some metabolic uh, things like hemochromatosis or Wilson disease. Next. So now first we will discuss the non-hepatocellular liver disease. Like first, uh, in this group we have the cholestatic liver disease. They basically affect the urinary system, like biliary system, or cholestasis. So whenever the obstruction in the blood flow of the flow of the bile is there, that will lead to the accumulation of bile in hepatocytes. This condition called cholestasis. The group of disease comes under this cholestatic disease are PSC, like a primary sclerosing cholangitis, or primary biliary cirrhosis. Some other drug-induced cholestatic reaction also occur, which lead to the injury to the liver, and they also cause the cholestatic type of diseases. Next slide, please. Now coming to the vascular diseases. So these are the basically affect the vascular compartment, blood supply coming to the liver or going from the liver. So like congestive heart failure. So whenever there is a common abnormality of circulation that affects the liver. This is whenever the heart is unable to pump the blood out of the left compartment, the backflow comes to the right side and then eventually to the liver. So there is a congestion of blood occur in the liver. That is called the congestive hepatopathy. So that will lead to the congestion tissue, leading to congestive hepatopathy and the development of hepatitis, fibrosis, and eventually cirrhosis. And the one other condition is thrombosis. Sometimes thrombosis or embolism they occur in the hepatic vein or portal vein that will lead to hepatic vein thrombosis will lead to Budd-Chiari syndrome, and the one other type of disease is the portal vein thrombosis. They also affect the liver. Next. Some metabolic liver disease also occur there. Whenever some minerals or biochemical substance their metabolism affected, and in that condition this type of disease occurs. First disease is the hemochromatosis. In this, the abnormality of iron metabolism occurs, and that will lead to the deposition of iron in the iron in excessive amount in the uh, hepatocyte, that will lead to cirrhosis in liver. And when this deposition of iron occurs in the pancreas, that will lead to diabetes. And similarly, in Wilson disease, the copper metabolism affected, and this excessive amount deposited in the liver, brain, kidney, and eyes, that will give you the respective diseases. Next slide, please. Now coming to the hepatocellular liver disease. So whenever the direct dysfunction of hepatocyte will lead to hepatitis, that is called the inflammation of liver. Now, here we discuss the types of hepatitis. So, majorly we have three types: toxic, autoimmune, and viral. Uh, Next slide, please. In toxic hepatitis, we have the predominant causes alcohol. So, the drinkers who are taking prolonged heavy drinking, that will cause to the firstly 90% of alcohol consumers they have fatty liver. That's called steatosis. Over the time, if the condition is not treated or alcohol not be stopped, that will disease further progress, lead to the inflammation condition called as alcoholic hepatitis, and furtherly cirrhosis, alcoholic cirrhosis or CLD. One other toxin is paracetamol. Paracetamol overdose also, because the liver is the major metabolizer of paracetamol. If one person consume the overdose of paracetamol, this will accumulate and lead to the necrosis of the hepatocyte. And similarly, the autoimmune hepatitis affect the young women, and this autoimmune disease, uh, own immune system of the patient, this work against the own hepatocyte and then lead to the hepatocytes, hepatitis, and furtherly cirrhosis. Next, uh, now coming to the viral hepatitis, because it's a major chunk of the diseases. So viral infection, they are the most common. We classify into two groups. One is hepatotrophic virus, which specifically infect the liver, like A, B, C, D, E, and G. And some are the non-hepatotrophic virus. These are they affect the other parts of body, other organs or cells of the body, but they also can cause hepatitis like cytomegalovirus, herpes simplex virus, and epstein-barr virus. Next, these are the some overview of the various hepatitis. So we see the disease durations firstly. So hepatitis, hep A and E, they cause acute viral hepatitis, while B, C, and D, they can cause acute or chronic. The mode of transmission. So mode of transmission is predominantly orophycal in case of A and E, and predominantly parental in B, C, D. And in case of B, this is predominantly sexual, while in case of C is predominantly by the blood or blood transfusion. The incubation period around 1 month is in case of A and E, and is highest in the case of B, which is 80 days. Uh, so this is the over and in out of five, the B by have B virus is DNA virus, and rest all are four are the RNA virus. Okay, next. Next slide, please. So, what are the consequences of chronic hepatocellular injuries? So, if the injuries not injuries remaining continuously, then which lead to the chemical release from the cover cells, B lymphocytes, T lymphocyte, macrophage, and NK cells, and that will lead to chronic inflammation. Chronic inflammation occurs while necrosis and destruction of hepatocyte by the cytotoxic T cell and NK cells, and that will eventually lead to fibrosis, and fibrosis eventually, if not treated, going to the cirrhosis. Next slide, please. We discussed the fibrosis. Formation of scar tissue in extracellular matrix. This call is the fibrosis. In patient with viral hepatitis, alcoholic liver disease, metabolic, vascular, and drug induced, any the disease we have discussed, they can cause fibrosis. The cell responsible for the fibrosis is the HSC, which we have already discussed, because in normal condition they are only vitamin A storing cells, but when the injury occurs, they transform into in the fibroblast, and they excessively secrete extracellular matrix, and extracellular matrix deposits in the space in the intercellular spaces, and that leads to the fibrosis. Next slide. The serious harmful effect on function of remaining the fibrosis cause the dysfunction of the hepatocyte. This hamper, they are also that will lead to the loss of microvilli from the hepatocyte. By loss of microvilli, they lose their ability to absorb the substance from the blood. And fibrosis also blocks the fenestrine, thereby the obstructing access of hepatocyte to the blood. And if injury continues, fibrosis progresses to cirrhosis. And when the patient develops cirrhosis, the prognosis become very poor. Next slide, please. So, cirrhosis. This is the end stage of fibrosis or end stage of any disease which we have discussed. So, whether the disease is originating from the hepatocytes or non-hepatocytes, they eventually, if not treated, can cause cirrhosis. So, because in cirrhosis, what will happen? There is a architectural disturbance or disorganization occur in the hepatic parenchyma. So these are three main characteristics of cirrhosis are necrosis of the liver parenchyma. Number two is the nodular regeneration. Uh, there will be formation of nodules of regenerated hepatocyte. When when necrosis of hepatocytes occur, so body tries to restore the hepatocytes. In this process, this formation of nodules occurs by the regenerated hepatocyte. That is called the nodular regeneration. And because of this nodal regeneration, change in the liver structure or liver parenchyma occurs. And these nodules they compress the blood vessel, and the blood flow through the liver is hampered. That will cause the portal hypertension. Next slide, please. So progressive and these cirrhosis are they are progressive and they may take decades to develop. If caught in early stage, they can be regress. So the cirrhosis caused by the Wilson disease or hepatitis C, they can be regress if they treated on the right time. So, what is the clinical presentation of cirrhosis? So, actually, no symptoms and diagnosed instantly sometimes. So, non-specific symptoms like fatigue and malaise they can occur, and sometimes when cirrhosis established, full-fledged symptoms like ascites, portal hypertension, and HE, that's called hepatic encephalopathy, patient might be present with these symptoms. Next slide. Okay. How can we how can we classify the severity of the cirrhosis? So for this, we have a simple score like Child-Pugh score. Child-Pugh score they have five variants: bilirubin, albumin, prothrombin, ascites, and encephalopathy. By calculating these data, we can classify the patient on the uh, mild, moderate, and severe liver disease. So we, minimum we have a score 5 and maximum we can have a Child-Pugh 15. Next slide. So if the patient have 5 to 6, which can be Child-Pugh class A, this called compensated liver disease, and patient having a score of 7 to 9, this comes under class B. This called uh, advanced liver disease or decompensated liver disease, and 10 to 15 is class C. On the basis of this, the mortality increases. In class A is mortality 10%, class B is more than 30, and class C is more than 80% of mortality. Next slide. The most important thing is hepatocellular carcinoma. So this is the primary cancer of liver. The major causes viral hepatitis B and C, alcoholic liver disease, and hemochromatosis. SCC can develop in cirrhotic liver or non-cirrhotic liver, but mostly 80% of SCC develop into the cirrhotic liver. So they are highly aggressive, mean survival is less than 1 year when diagnosed. They are diagnosed in a very advanced stage. Sometimes they are untreatable by surgery, chemotherapy. So, and sometimes if we pick the right time, we can save the life of the patient by the transplanting the liver. Next slide, please. So some signs, symptoms, and clinical complication of liver disease. So liver disease can be present like jaundice, portal hypertension in form of uh, ascites or GI bleed or black color stool is called melena or hepatic encephalopathy. Uh, and these are the symptoms when, if not treated, they hamper the quality of life of the patient. Next slide, please. So these are the other system which affect in the liver disease like neurological condition, which as we already discussed, hepatic encephalopathy, skin disease. Some they have jaundice and rashes. Uh, GI system they have nausea, vomiting, pain, abdomen, ascites, and in hematological they have severe anemia, pancytopenia, sometimes bicytopenia. Uh, in reproductive system they have testicular atrophy, gynecomastia, and cardiovascular system they have heart failure and cardiac ascites. Next slide, please. So now we'll discuss the evaluation of liver function. How we evaluate uh, one patient or somebody's liver is functioning, liver is doing well or not. So we can evaluate the liver function by simple blood test called liver function LFT. So LFT measures the hepatocyte damage and hepatocyte functions. So uh, in measurement of hepatocyte damage, mm, we have like SGOT and SGPT. By screening these enzymes, we can estimate the severity. We can estimate also disease progression or prognosis, and we also assess the effect of treatment on the liver. Next slide, please. So in LFT, we have liver aminotransferases like back previous slide. Aminotransferases. We have like ALT, that is also called as SGPT, produced by hepatocyte, and this is a more specific marker than the SGOT because SGOT also produced by cardiac muscle, brain, kidney, and blood cells also. And when AST is more than ALT, so this condition is seen with the alcoholic hepatitis, and the viral hepatitis ALT is more than AST. Next slide, please. Similarly, alkaline phosphatase is also found in liver, bone, and intestine. In liver, mainly cells that line they are the bile canaliculi. So, whenever the obstruction of bile flows occurs, the ALP rises. So, it's a strong indicator of cholestasis. Similarly, gamma GT, the level correlated with the ALP, and this is the most sensitive marker of hepatobiliary disease. LDS is not so specific for the liver because produced by other organ also. Bilirubin is the true LFT because these all other markers which I've discussed, they are the indicator of liver damage. But this bilirubin shows the function of liver. So that's called liver function test. This is true LFT, and the bilirubin elevated indicate impaired liver function as opposed to the damage. Next slide, please. Uh, Same we have discussed already, alkaline phosphatase and bilirubin. Next slide. Albumin. This is the most abundant plasma protein, and this synthesis by liver, and the level decrease in advanced liver disease. Similarly, prothrombin time, the normal level is 10 to 15, and the prolongation of prothrombin time is a sign of advanced liver disease, and this also can result from the vitamin K deficiency. Next slide. So these are the normal values of various parameters we have discussed already. Next slide, please. So some are the invasive tests by which can be assess the function of liver. One is the ERCP. So in ERCP, we have combination of endoscopies and the fluoroscopy. And in this procedure, endoscope introduced by a mouse into the second part of duodenum, and we recognize the papilla and the CV is cannulated by the sphincterosome, and then we serially do the cholangiogram, and then we can just see the where is the stone stricture or any other filling defects in the course of CVD. Similarly, we have percutaneous transhepatic cholangiography. Similar in the principle to ERCP, except the contrast agent is injected percutaneously, not by endoscopy. And this condition is done when we are unable to do the ERCP in case of like duodenal edema or some altered anatomies there. Next slide, please. So, liver biopsy is the gold standard test for the diagnosing liver disease, but valuable information on the stage of fibrosis and necroinflammation which we can get by the doing liver biopsy. In this procedure, we remove a small piece of liver tissue which is analyzed under the microscope. We can Liver biopsy can be done by the percutaneous or endoscopically or US basis. A disadvantage of liver biopsy is there is invasive procedure. They have various complications associated with the liver biopsy like bleeding, hemorrhage, bile leaks, etc. Next slide, please. Okay, so like this, we ending the session. Uh, any questions, please?
Thank you so much, sir, for this wonderful talk, and your talk has really enlightened us. So, with your permission, sir, I want to take some questions from the audience.
Yes, please.
Uh, so we have one question about the diet, that what diet should a liver patient take?
Actually, for liver patient, fatty foods they are harmful. So one liver patient should include less carb and more protein diets and less fat diets in their food. So actually, liver patients they need at least one to 1.5 gram proteins per day. Suppose the patient weight is around 50 or 60 kg, so 1.5 will multiply 60 is comes around 90 gram proteins per day. So they try to take egg, especially white egg, uh, pulses, or they can take some protein powders. So protein diet should be uh, completed because the liver is the organ which synthesizes proteins. If liver is not working normally, protein synthesis will less, edema will develop. So more protein, uh, less fatty diet, and less salt restriction also done in case of liver disease. So less than 5 grams salt per day should be taken, not more than 5 gram. If we will take more than 5 grams, it will cause again development of edema and ascites.
Thank you, sir, for this wonderful insight. And we have one more question about the role of lifestyle modification in liver disease.
Yes, this is the very big concern today's life, today's time, because everybody has a sedentary lifestyle. They have office work. They're not going to outside, not doing exercises. So at least patient having fatty liver or NFLD or some kind of liver disease should regularly do their some modification in their lifestyle. So at least jogging or running at least 30 minutes per day, at least 5 day a week. If you can do 7 days is okay, but at least minimum 5 days should be done. And it should not be like just walking. Walking like when your heart rate goes more than 100, or while jogging you can develop sweating. So this type of jogging is required. So exercise is very important in case of liver disease, and diet is already discussed. So diet and lifestyle modification, we include exercises, and we include some diet modification by which can we can overcome the uh, increasing liver disease.
Thank you so much, sir. So, on behalf of Nash 24/7, I would like to thank Dr. Jagveer Choudhary for this lively talk and informative talk. So, as you have been emphasizing the awareness for liver health and disease, sir, I think it's equally important for people affected by fatty liver to regularly visit and continue their medications. So,
Yeah,
with careful, yeah, sir, please, if you want to add something.
no, no. Actually, sometimes what the patient do, they do uh, they not taking care of their diets, their exercise, and their regular visit to their gastroenterologists or doctors. So actually, a regular visit to the OPD for the doctor is very much required, because doctor only the guy he can guide you what should be done at this particular point of time, what medicine you can take or what medicine you cannot take. This is also equally important. So it is okay to everyone to know about the liver disease, because liver is a vital organ of the body, which can support the normal functioning of body.
So, to monitor your liver health, you have to regularly visit the doctors and continue your medications. With
Sure.
careful observation and precautions, it is possible to obtain control on the disease. I would also like to thank our audience for their active participation and patience in making this event successful. Stay connected with Nash 24/7 on Facebook and YouTube. Take care of yourself and your family members. Thank you. Thank you, sir.
Thank you very much. Thank you.